As we begin Breast Cancer Awareness Month today, a new report provides some optimism. The American Cancer Society now says breast cancer deaths have fallen by 44% compared to 35 years ago, saving nearly 520,000 lives. While the report revealed many promising trends, the data shows breast cancer rates in Asian Americans and younger adults are on the rise. Racial disparities in breast cancer continue to persist. The disease is the leading cause of cancer deaths for Black and Hispanic women and remains the second most common cancer among women in the U.S. after skin cancer. We have Andrea Deloney and Julie Plummer here now from On-Site Women's Health Talk more about raising awareness. Ladies, good morning and thank you for being here.
Good morning. Thank you for having us.
Andrea, when you hear those kinds of statistics about the number of deaths going down over the years, what's kind of going through your mind as someone in this field?
I think it's very exciting that we're getting the word out that early detection saves lives, and the best way to detect breast cancer early is through a yearly screening mammogram.
Yeah. And the numbers show that even though these deaths are going down, Julie, this is still affecting a lot of lives. Tell me more about that.
Absolutely. 1 in 8 women will develop breast cancer at some point in their life. So, when you enter a room, you will know somebody who has been affected by breast cancer, whether it be themselves or somebody that they know or a best friend or a mother. It just affects more women nowadays, and 3 out of 4 women diagnosed don't even have any family history
My goodness.
of breast cancer.
Tell me a little bit more about that, Andrea. Do you think that gives women kind of a sense of security if they're like, well, no one in my family has it, How does that impact their mindset when it comes to getting screened?
Absolutely. As a mammography technologist myself, I hear that so often. Patients will come in and say, well, I haven't had a mammogram in years because I don't have anybody in my family that has it. And so while it is true, if you do have a family history, it runs in your family, will increase your chances of being diagnosed with it. It does give that false sense of security that, every woman has got to be the first one in her family to be diagnosed with it. So,
my goodness. Tell me about how you all work at On-Site Women's Health to try to make this as convenient as possible for women and men to come in and women to come in and get screened. Or since y'all are women's health, do you do both or?
No, while it is true that men are diagnosed with breast cancer, about 3,000 cases a year, there's just not enough clinical indication for men to be screened. So that's why the largest or the most risk factors for women for breast cancer is women being female and age. And those are 2 things that we just can't do anything about. So we do need to be screened. On site, we partner with primary care and OBGYN offices to offer screening mammography and diagnostic, in some cases, services in their offices for their patients to make it convenient so they can pair that up with their annual exam, not make a second appointment, and we're all busy women. So we try to make it convenient.
Yes, we appreciate hearing that for sure. And I know y'all have a lot of locations too. So thank you both for being here. We appreciate it. Folks, we're going to have more information at WKRN.com.